Welcome back to Ophthalmology for undergraduates and postgraduate beginners. We are discussing about complications of cataract surgery. Today I am going to talk about yearly post-operative complications of cataract surgery. Already I have told that any complications occurring from the time of surgery up to 4 weeks is called as yearly post-operative complications. The common complications we see in the yearly post-operative period are iris prolapse. Iris prolapse, you can see in this picture, the iris is red in color. The iris has come out of the globe through the wound. This is called as iris prolapse. When do you expect such an iris prolapse? When there is a gaping in the wound. We are making an incision and going inside. There is a surgical wound. If the surgical wound is not tightly closed, then the iris prolapse will occur. It may be due to poor construction of the surgical wound, or it may be due to undue straining of the patient following surgery. Either way, you can get an iris prolapse because of the gaping of the wound. When there is a gaping of the wound, what will happen is the aqueous humor will also come out of the eye and the anterior chamber will become shallow. You can see in this picture the cornea is not rounded, it has become flat. The anterior chamber is not deep, it is very shallow. So such a thing will occur. So good wound in construction and patient's cooperation following surgery are very important in preventing this complication. If such a complication occurs, the patient has to be taken to theatre for replacement of the iris into the eye and suturing of the wound. The next common complication we come across in the yearly post-operative period is striate keratopathy. When you look at the eye, the cornea will be edematous and it will be opaque, or it will have a ground glass appearance. You can see multiple crisscross lines in the cornea, whitish lines will be there. So that is called as striate keratopathy. Why it occurs? The cornea is having the endothelium as its posterior layer. When we are very young as a child, the number of endothelial cells are 3500 cells per square millimeter. Every year, the count of the cells, the cell density decreases by 0.006%. Approximately about 20 to 25 cells are lost every year per square millimeters. This is what is happening throughout our lifetime. When we have a trauma in the eye, or when we have a inflammation within the eye like uveitis, when there is a glaucoma or raised intraocular pressure in the eye, or some other diseases inside the eyeball, then the count of the endothelial cells, they reduce to a very great extent. The next thing that reduces the endothelial cell count to a very great extent is surgeries. When we do intraocular surgeries, we are taking instruments into the anterior chamber. We are taking medicines into the anterior chamber. All these things destroys certain number of endothelial cells. There should be a minimum of 700 cells per square millimeter for the cornea to be healthy. If more number of these endothelial cells are lost due to certain diseases already present in the eye, or due to this surgical procedure, then if the number of cells go below a certain limit, that is 700 cells per square millimeter, then these cells that are remaining there cannot function properly. The main function of these endothelial cells is to pump out excess amount of water present in the cornea. When the number of cells they reduce to a very great extent, lot of water gets collected within the cornea, leading to striate keratopathy. If it is not resolving on its own, it will go in for bullous keratopathy later. So we have to make sure the endothelial count is adequate and normal before doing the cataract surgeries. Third important complication in the early postoperative period every surgeon fears is acute bacterial endophthalmitis. On the next day or the day after, when you see the eye, patient will have severe pain, redness, the cornea will be white, there will be pus in the anterior chamber. Such a picture will occur. If you see such a picture on the next day while opening the bandage, then it should be an acute bacterial endophthalmitis. This is due to improper precautions taken both by the surgeon as well as the patient. The surgeon has to make sure the patient does not have any septic focus in his face or his eyes or in his body before surgery. He has to make sure everything is taken care of by giving prophylactic antibiotic drugs. The patient should cooperate with the surgeon. He should maintain or she should maintain high degree of hygiene before surgery or following surgery. That way, this infection causing acute bacterial endophthalmitis can be prevented. We are all fearing of this complication because this endophthalmitis will lead to end of the eye. That is, there will not be any recovery of vision to the maximum percentage. So it is not possible to get back the vision following such a complication. So strict hygiene is very, very important. Strict precautions has to be followed in all cases undergoing cataract surgeries. With this, I will stop here today. We will continue with the late postoperative complications in the next video. Thank you.